Hello, Blazers. Welcome to UAB Green and Told. This podcast is your front row seat to the stories that inspire and connect the UAB family. Welcome to episode 173 of UAB Green and Told, originally released Monday, April 6th, 2026. Want to catch up on past episodes of UAB's most listened to podcast? Visit alumni.uab.edu/green and told or find us on Spotify and the Apple Podcast app. And while you're there, leave a written review so more Blazers can discover us. I'm Greg Berry, a UAB alum and Director of Communications in the Office of Alumni Affairs. What drives someone to step into the chaos of life or death decisions? For today's guest, Kevin Wall, the answer began in a hospital room, not a classroom. At 8, he endured a marathon of surgeries that stretched across a year and a half. Those long, sterile hallways became a backdrop for a dream. But as we'll learn, his UAB experience was a glimpse into the future. His daughter is also a Blazer, and the changes he saw through her eyes was a striking contrast to his collegiate days.
When she came to tour her freshman year, the campus had changed so much. I'm like, well, 25 years ago, that was this building, and 25 years ago, that was this building. And so it really has grown and changed a lot.
Plus, before Kevin ever led a team, he faced a moment that tested his instincts as a student. Alone in the ER, he had to make a call that could change everything.
And I think that was the moment that I realized, okay, I can do this and I can, operate at a pretty high top of license level post-graduation.
Fast forward to today, and Kevin's guiding principle in critical care is simple but powerful. As we'll discover, it's a reminder that certainty is an illusion when lives are on the line.
X never marks the spot. I tell my staff, if you get an ambulance report or a report from the scene, it's probably going to change a little bit by the time they get there.
Now a seasoned critical care professional, Kevin Wall first walked onto UAB's campus as a nursing student in the mid-90s, carrying a determination born from early experiences. From the familiar streets of Pleasant Grove, Alabama, to the fast-paced world of intensive care, Kevin's story is a blend of grit, growth, and grace under pressure. His journey isn't just about medicine, it's about moments that matter both in and out of the hospital.
I knew I wanted to help people. I had a series of surgeries when I was 8 years old, and that was completed at Children's Healthcare of Alabama over about a year and a half, a little over. And I knew I wanted to help people, and I knew I wanted to help people on their worst day. And I just didn't know how, and it took me a little while to find that journey, but I knew I wanted to give back to those that had given to me when I was, ill and dealing with the challenges that I had to deal with.
And critical care in particular as well. If I'm not mistaken, you saw challenges with your grandmother in rural Alabama and just being able to get help to her.
We did. And so that's one of the driving reasons is we were fortunate to live, again, just a few miles outside of campus. So we had the resources of UAB, of Children's of Alabama, and the other large health systems in Birmingham. My grandmother at the time lived in Blount County, a very rural part of the state. She had atrial fibrillation, which is a heart rhythm problem, and it has a increased risk of blood clots and stroke with that if left untreated. And I was with her in the ER one time in the small community hospital, and they properly recognized that it was a cardiac condition was the root etiology, but she was having an acute, neurological event because she had thrown a clot, and they really weren't monitoring that. They really didn't have any neurosurgery support, any neurology support, or no critical care support. And so it was really a challenge to say, she has more issues than this one. We need to get her to, resources that can help her in this acute stage before this, becomes a chronic issue and a chronic problem neurologically.
How old were you at that time?
I was probably 17 or 18 at that time.
You knew at that point nursing was in the cards.
I did. After graduation high school, I went to Tuscaloosa for a year. It just really wasn't a fit, and I don't know if I was kidding myself that it really was going to be nursing. I think I was a psychology major at that point. Said, well, I can help people in the psychological aspect of it and the challenges of illness. But it really just became apparent and solidified along, those lines with her episode to say, this is what you really need to be doing. You really do need to stand beside people on their worst day, get them through it as best you can. And then that propelled into get them exactly where they need to be to definitive care and treatment.
What went into leaving Tuscaloosa and coming back home and attending UAB?
I think just the reputation of the school. I mean, the Capstone has a nursing school, but at the time, it still remains, I think UAB was a top 3 to 5 nursing school in the nation. And I knew some folks that had graduated and they were just really prepared for what was next and really were able to hit the ground running with very minimal spin up and really take on the challenges of whatever role they accepted. So made a decision to come back and took a summer course between freshman and sophomore year, loved it, enrolled fully, and 4 years later got my degree in nursing and also a minor in biology, which was not a requirement at the time, but went ahead and completed that as well.
When you were here in the early to mid 90s, campus was drastically different than it was today, and the entire collegiate experience was different. What was it like for you during that time?
Very interesting. I mean, UAB is such an international campus, and I think that was, very conducive to learn other people, where they come from, their challenges, and their learning experience. So that was a great part of it that I really embraced and enjoyed at my time. The rec center was a tiny little gym. It was interesting. My daughter is also legacy at UAB, graduated in 22. When she came to tour her freshman year, the campus had changed so much. I'm like, well, 25 years ago, that was this building, and 25 years ago, that was this building. And so it really has grown and changed a lot, but it was close-knit. Even though there were people from all over the country, all over the world, it was very close-knit. There weren't these silos or groups where you had to participate in the Greek system, and if you didn't, you were excluded, and you had to participate in the honor system. If you didn't, you were excluded. Everybody embraced everyone, and it was just very welcoming, warm, and really seamless to make acquaintances, friends, connections to help school or to find things to do socially during off time.
Post-college, what was the plan at that point when you first graduated in 95?
Towards the end of nursing school, one of my last clinical rotations in preceptorship was in the ER at UAB. And that really was the catalyst to say, this is the direction. I really enjoyed that much more than the ICU rotations for me personally. I remember one day towards the end of my rotation, and you're always nervous. Can you handle this? Can you do this? Are you going to be able to take the next step and be on your own? And the nurse I was precepting with, she went to lunch, and we had the fast track area, and there was just a couple of patients in there. And she said, everybody's stable. Just continue to monitor. I'm going to take my lunch and I'll be back. One of the gentlemen in there who was for observation for chest pain began to feel a change and discomfort. I went over and grabbed the EKG machine, and he proceeded into having a myocardial infarction or a STEMI. And so we ordered the charge nurse, ordered cardiology. He gets whisked away to the cath lab immediately. The nurse that I'm precepting with comes back to lunch and asked where the patient is. I said, well, he's in the cath lab now. And I had saved a copy of the EKG, and I said, here's what happened while you were away. And she goes, and you recognize that? We're able to move on that and get him to definitive care. And I said, well, he had to go. We couldn't fix him in the ER, so he had to go up. And I think that was the moment that I realized, okay, I can do this, and I can operate at a pretty high top of license level post-graduation. So I sought out opportunities to do that and wanted a new challenge. And UAB had been such a good experience with a teaching institution. There's so many great nurses, physicians, everybody that just is great with teaching. But I wanted a new challenge, and so I sought out and wound up at Huntsville Hospital, which was at the time second busiest ER by volume in the state, and a level 2 trauma center. Although they function pretty high up, the physician staff just was not on site, but many of them lived across the street, so they just weren't in house 24/7 while they didn't have the level 1 designation at that time. But it was busy. It was extremely busy. They had over 35 board certified ER physicians, and they expected you to operate top of license. And they too, much like the UAB faculty, were teachers and instructors. And so you really got to do a lot in those days as a nurse.
In ER and critical care, you see everything. There's nothing that you probably don't see or experience.
It's never the same day twice, and you've got to be ready for whatever walks in the door, or if you're in an ambulance, whatever you pull up to or land at in the helicopter. So it's never, X never marks the spot. I tell my staff, if you get an ambulance report or a report from the scene, it's probably going to change a little bit by the time they get there. If you're going to a transport, whether it be to a facility or to a scene, and you get a report for that patient, it's probably going to change. So it's a little bit like Christmas. You walk in, you go, okay, here, this is what we're doing now. You go from there, assess, stabilize, and then, make decisions on what you need to do for interventions.
And I don't think comfortable is the right word, but I'm going to use it. How do you ever get comfortable with doing those types of things?
It's methodical, and I give credit to the School of Nursing. I mean, the assessment skills, the ability to prioritize, the ability to quickly process the information from the patient or from the test results or radiology results allows you to do that. So it always slowed down for me, whether I was taking care of the individual patient or working as the charge nurse or the critical care ground transport nurse or the flight nurse. It always slowed down. And so you get into the moment and you begin to assess, and you just methodically go through. And you go through your steps for the assessment, your primary assessment. You make those stabilizing interventions, and then you continue on to the next step, whatever that may be.
You did a lot of ground, you did a lot of air. Do you know how many different missions you were a part of over the course of your career before you shifted more into administration?
Gosh, hard to say. Even when I was not working, one of my dear friends was a supervisor for the ambulance service, and I would do first response with the ambulance service. So I lived in Madison at the time, so we would do first responder. If I were over at his house, we would do first responder. He was heavy in the rescue squad in Huntsville, Madison County, also with a high angle rescue team. So I would tag along sometimes in those instances as well. So busiest ER in the state, did that for 4 years, I think it was. And then a very busy ground critical care and flight program. So thousands, too many to count.
You have made different moves throughout your career to get to where you currently are. Were they very methodical and deliberate decisions along the way?
So the methodical part of the career process was yes, to be able to perform at a very high level with ground critical care transport or flight. You have to have a good bench of background, history, knowledge, and time in a critical care environment, either an ICU or an emergency department. And so you need that time and that experience and those repetitions to really hone those skills, hone the assessment skills, hone the treatment skills, the acute procedures that you perform before you step into that arena. Because once you're in the back of the ambulance or once you're in the back of the helicopter, you're the sole provider. It's you and your partner, if you have one in a critical care situation, and you have to rely on each other. So you don't have the ability to call radiology and go, hey, what do you think about, this issue? Or what would you do? You are on your own, and you've got to rely on your assessment skills, your protocols, your training, everything to sort through those issues. Many times, certainly later in the career when we were responded via a helicopter to extremely rural parts of North Alabama or Southern Tennessee, there are many times that we would show up on the scene and we were the first licensed medical providers there. You would have perhaps law enforcement or a volunteer fire situation, but we were the first licensed medical staff on scene in some of those situations. You start triaging and assessing and start making decisions and treatments from there.
When it comes to getting on the ground on a run like those that you mentioned, what time frame do you have to really assess the situation? Because we're talking seconds to minutes, not 10, 15, 20 minutes. You have to act and react right away.
You do. And so we would like to be, on scene for 10 minutes and then moving, whether that be at ground or air. So now that obviously if you're in an extrication situation or they're pinned or some way, but normal, you'd like to go into your primary assessment, do anything immediate that you need to do it, and be headed to the destination within 10 minutes. And we would start looking at it as a quality perspective. If you were over 15, why did it do that? Well, we were down in the ditch. We had to hike up back to the vehicle. It took us a little time, whatever those were. But we would look at it if, you were pushing that 15-minute limit. So we wanted to be in and out within 10 minutes on scene.
At what point during your career did you think to yourself, okay, I think it's time to make the move and move away from the hands-on and get into admin?
So very early, I was tapped to be a charge nurse. And so I was probably one of the younger ones that was doing that at the ER at that point, which was pretty good, pretty interesting to do. Especially some of the physicians look at you and went, you're in charge? Yes, I'm in charge. And so I was pretty successful with that. The crews that I worked with, worked really well with me. They're a great team. And so it kind of grew from there. It was really this interest in, I can affect one patient at a time at the bedside, whether that be in the ER, in the ambulance, in the helicopter, but I can affect multiple people annually if I set the system up, run the system, make the system efficient. And in my current role, I'm able to serve over 50,000 patients annually because of the way the system is set up and runs.
The volume that you have right now is just incredible at Advent Health in Central Florida. You mentioned the 50,000 different patients. You have 300 team members. You have a large operations center. What's it like overseeing this department that you have?
A lot of moving parts.
Yeah.
I have a really great team. And when I looked at this position, I talked to 4 people throughout the country. Transport and critical care is a very small community. So there's a lot of resources around. One of the benefits of that is you get really good information. And one individual that I've known for 25 years said, this will be the best leadership team you have above you, with you, and under you. And they have been absolutely right. It's a phenomenal team that we give a lot of width to operate and do their job. And so I have the ability to say, here's where we're going. These are the goals. And this is when we need to get there. And they do a really good job of, taking that vision or that initiative and saying, okay, here's how we can put this together and make that goal work and get there. And so it's really a collaboration for our dispatch team and our leadership, our ground, as well as our flight. And so all 3 will integrate and touch each other every single day, along with our mission control staff, who is really the eyes and ears for what's coming and what's coming next for us.
How has critical care changed over your 25, 30 years?
The technology is just going at a breakneck speed. I mean, you look at just myocardial infarctions or heart attacks, for instance. We used to give, you just give the lytics or therapeutic for the blood clot removal and hope that worked. You can give TPA and hope that worked in many instances. And now you're going to the cath lab. There are small community hospitals that are, able to perform interventions now that only, in the late 80s, early 90s, only UAB or, back in the day, Caraway were performing in Birmingham. Now you've got smaller community hospitals performing that. So the technology has been huge in increase. I think the cardiology space is interesting we talked about my grandmother and the atrial fibrillation and the increased stroke. Now there's a device that you implant in the heart that helps reduce that. You can exchange a heart valve without having to have open heart surgery anymore. And it's just the technology is amazing with all the support devices that you've got now with balloon pumps or Impellas, for cardiogenic support. We're actually starting individuals that are in full arrest, the ECPR, to where you cannulate and put them on pump, and then work to take that stress off and find the etiology of the pump problem with the heart, see if you can correct it. And it's just some really phenomenal outcomes. So there's a lot of folks across the country doing such interesting work with this, including the team back at UAB.
When your daughter started talking about coming to UAB, what kind of conversations did you have with her?
She really looked at a lot of people that had gone to Georgia and Georgia Tech, and some of them were struggling to find their place, and it wasn't the right fit. And so I always talked fondly about it. I always told her stories about whether it was School of Nursing or I taught undergraduate anatomy labs at Campbell Hall for many years. And just those stories. And she said, I want to go look at it. I want to go see what it's about. And she was interested in neurosciences, and they've got a phenomenal neuroscience department. And so she came over, fell in love with it, and has her bachelor's in neuroscience.
That's Kevin Wall. Kevin earned his Bachelor of Science in Nursing from the School of Nursing in 1995. Today, he's Director of Emergency Medical Services in Flight 1 for Advent Health in Orlando, Florida. With determination that matches UAB's, he has a great idea of what it means to be a Blazer.
Well, I think find the obstacles, and if you can't remove them, then sometimes the obstacle becomes the way. And I think that has been, imperative with what was instilled at the School of Nursing and my undergraduate work there is there's always a way. Look at different things. You look at the state of Alabama now with the critical care air services throughout the state. When I was at UAB, you had one helicopter in Mobile, you had the Caraway helicopters in Birmingham, and you had one helicopter in Huntsville, Alabama. That did nothing to help someone in Crane Hill, Alabama, in Central Alabama, in Dothan, Alabama. They're just too far away. And so there's a lot of obstacles that say you can't put a helicopter in Vinemont, Alabama, or Muscle Shoals, Alabama, or Scottsboro, Alabama. So you work around that and you figure out how you can do it. And you figure out how you can put together a pediatric critical care transport program in Huntsville and provide new services, different services, and bring that resource to a community that has not had that available before, to be able to decrease that time, bring a high level of care and treatment to them in a rural setting or a community hospital setting, and then get them to definitive care at a large tertiary or quaternary center as quickly as you can.
Thanks for spending time with us on UAB Green and Told. To hear more stories from the UAB community, visit alumni.uab.edu/green and told, or find us on Spotify and the Apple Podcast app. Got a guest suggestion? We'd love to hear it. Email us at greenandtold@uab.edu. And be sure to follow us on Facebook and Instagram for more alumni stories and updates. Thanks for listening, and as always, go Blazers.